Now, the Gauteng Health Department is increasing the number of vaccination sites. An additional 25 sites have been added in Johannesburg, Tshwane and Ekhuruleni. For more on this, eNCA senior reporter Barry Bateman joins us now live. Barry, what are you seeing at these new sites? Is everything going smoothly?
Good morning, Maseka. Well, I'm not actually at one of the new sites. I'm at Charlotte Maxeke Hospital, one of the established sites. And the reason I'm here this morning is because there's going to be a Portfolio Committee on Health Oversight visit. The committee is conducting these oversight visits throughout Gauteng to gauge the response of the government to the second phase of the vaccination rollout. You'll recall that the second phase entails rolling out the vaccines to elderly people and people with comorbidities. Now, it is a quiet morning. I remember seeing the scenes here from my colleague Heidi Jokos just a couple of weeks ago, and it was, you would describe it as an organized chaos, but it's far more subdued. It appears to be very much organized. There's a mix of people here. We understand there's some healthcare workers, some of those people who didn't get their vaccinations during the first drive, and of course some of the people over the age of 60 and those with comorbidities here to get their vaccinations. Now, what the Portfolio Committee will be doing when they come here, firstly checking the availability of stock. They will checking to ensure that the vials and the used medical waste is disposed of in the appropriate mechanism or manner. And they will also just speaking to the people here to ensure that everything is under control. And of course, later in the day, they will be having a meeting with Gauteng's Health Department before going back to what they do down in Cape Town and writing us a report.
So everything going smoothly there, Barry. Have you heard anything from the Health Department itself with regards to these 25 new sites?
Not at this stage, but we do understand they've been open for a couple of days already, 25 new sites, just bolstering in specific areas. For example, let's take an area in central Johannesburg where there would have been an original site or the first site established. There would be maybe one or two more in the larger area just to spread those numbers around, bring the access closer to people. So where somebody might have had to travel maybe 10 kilometers to get to a local place to get their vaccination, they mightn't just have to travel a few kilometers now. So that is the rationale behind it. It's all about providing access to people, spreading that load, because remember, we are eventually going to go into another phase, and the number of people who then become eligible for vaccinations will increase substantially. So we're going to need more sites. I think the introduction of 25 now is just the start of what is going to be required once we get to a full vaccination process. So we've got these sites that have opened. If they're anything like this, I think it's quite safe to say they're in good hands.
All right, Barry Bateman out for us at the Charlotte Maxeke Academic Hospital. Let's leave it there for now.